I'm going to show you how to manage the patient details questionnaire. So we have a patient details button here, and we will be able to send all the details to fill by the patient before they come to their next appointments. They can make it for the first time or they can edit it. But the issue is that due to NABID, we have in medical a big number of questions, okay? And this big number of questions coming also in vitals and allergy, and we have no options to change it. Allergy, you have allergy to things that you don't even know what it is. Sotatol, what is this? Patients don't know that. So we need to modify that if needed, but we are not allowed to remove it from your list. But we can avoid sending all this full list with so many items to the patient to make things easier for them to fill. Let's take an example. Vitals. I have 1, 2, 3, 4, 5, 6 questions. Too much. I need to know only the blood pressure, systolic and diastolic. That's all what I need. So to avoid that, I go to utilities. I go to medical questionnaire. And in medical questionnaire, I am going to check the vitals. I have the vitals. And the first one is the body temperature. I edit vitals, and in vitals sent to the patient, I say no. I don't remove, I don't delete, I just don't send that questions which is not needed to the patient. And I do that one by one. Pulse rate, I don't want that. So I say no, I don't want to do it, okay? And I reduce the number of questions which I'm going to send to the patients. So respiration rate is not interesting for a dentist. I say no. The issue is that NABID imposed that to us. We cannot remove anything. Systolic I keep, diastolic it is. Saturation in oxygen I can remove. And I have been doing the job. And I do that only one time. No need to do it every time. So now if I go back to the vitals, I say that I have no. I have 2 vitals, and that's enough for me. So based on these settings in the utilities, I can go back to the patient's file. I go back to the patient's file. In the patient's file, I can go to patient's details. So you see in the medical that all the list is there in the medical, okay? We did not delete anything. And this is mandatory to work with NABID. And I go back here and I am going to ask the patient to fill it. So patient's details, I send that. I am going to send it by email. So I have an email here. It's okay. The email has been sent. I am going to check in my emails what I have been receiving. Here is what I receive. Please, so I am the patient, Daniel Ocampo. Please click here to access and update your data. You send the patient to fill their file. So they have all time to do it, and they are going to fill their file in this way. So let me show you this. This is the file. You have the title, the first name, family name, all the details, the contact details, the residence status, the chief complaint. Chief complaint you can also modify. This is personal. This is not coming from NABID, and you can ask a series of questions linked to the dental state of the patient, okay? The medical questionnaire is coming here. You did not change anything, so you have all the list, which is very, very big for the patients. They don't like that. And you see that I have been able to modify the questions I want to put in vitals, and I have the blood pressure systolic and the blood pressure diastolic, and that's it. I don't have the rest. If I want, I say yes, yes, and I can put the value of the systolic. which is this one, and which is, for example, this one. I go down, I am the patient, so I don't want the patient to feel all these things. I mean, it's too much. So I will do the same settings I did for vitals, for the allergy, and for the medical questionnaire. I can submit now, and when I submit, I am the patient. I am submitting what is in my file, and I receive an email. AccuDent demo thanks you for updating your details. This will be received by the patient. All data are in your file now. They know that they've been doing the things in a good way, and based on this, you can work with the patient in an easy way. So I would advise you to reduce the number of what is sent to the patient to make a better access to the data for the patients and yourself. I thank you for your attention.